Becoming addicted to prescribed opioids years ago, he's now in recovery and is the lead plaintiff in a $1 billion class action lawsuit against some of the biggest pharmaceutical names in Canada, including Johnson & Johnson. Gerald, good morning. I'm glad you could be here with us to share your story. First of all, can you explain briefly, why did you start taking these drugs in the first place? Why were they prescribed?
It was prescribed to me. I had injured my back, and I also had a thumb injury. So it started as an innocent prescription for Percocet.
For Percocet. How did you become addicted?
It's complicated, but it just I started relying on it more and more as the back pain has been chronic, so it's continued over the years. And as I relied on it more and more, I found that it felt good too. Like for me, I felt the euphoric, or it felt good, the effects of it. And it was like an immediate antidepressant, and I felt that it just kind of melted away my personal problems as well, and that kind of helped when I was going through times of stress.
Why is it that some people, do you think, become addicted to this drug, whereas others do not?
Yeah, it's amazing. But for me, I mean, immediately I felt the euphoric effects. And other people, they'll say it'll help them, but they don't feel the same sort of intensity like I did. So it's a big risk factor as a physician when it's prescribed to ask the patient, did it make you feel happy, or was it just good for your pain?
That's a very interesting point, because I think when we hear this story about Big Pharma being held responsible, people wonder about the doctors that are prescribing this medication. How do doctors know? Do you think that doctors are partly responsible for this crisis that we have with opioid addiction?
Absolutely. I mean, that they play a part as well. It's a complicated, multifaceted issue. And then back in the 90s and early 2000s, that's when I was training as a resident in the emergency department. And then it was looser. You know, the threshold for us to prescribe was lower, and pain was considered the fifth vital sign. We must treat it aggressively, and if you don't, you can get poor patient metrics, and that could affect your career in the future. So there's a lot of stress on us. And so I'm guilty of that when I was a physician. I didn't realize I was putting people in harm's way. Like I said just a minute ago, that some people immediately, they feel the euphoric effects, and now the cat's out of the bag. They've had their first taste, and it's hard to go back for some people.
And here you are, the lead plaintiff in this case. What are you hoping for?
My main goal really is to conquer the opioid crisis. I've learned so much. I've gone through so much in the last 5 years. And I'm in a unique position, being somebody in recovery and also a physician. And I see so much suffering, and I hear the outpouring of letters I get on Facebook each time I make an appearance like this, and people reaching out to me and saying, you know, thank you for standing up and admitting that you've had a problem, and I have a problem too, or my loved one has a problem. There's so many people that are suffering silently as well, which is a big shame. So helping to destigmatize it and letting other people know it's okay to talk about this. It's okay to talk about mental wellness and other issues too. And so it's the opioid crisis. How do we start combating that? How do we start tackling that? And this is getting the conversation, the dialogue open is important.
Do you feel that this is a drug that still has a place in our society? Should it still be prescribed for people suffering?
Yes, of course. It needs to be. This is, you know, the doctors are the gatekeepers. And as long as they use good judgment and document it, which is really important, like the College of Physicians and Surgeons, they've come out recently in their recent magazine article saying, our guidelines are just guidelines. You don't have to adhere to them like it's law. Just document in your chart why it is that you did not wean this patient who's been on chronic opioids for 30 years. And it's tragic that you see some physicians rapidly tapering their patients or taking them off it completely. And now we put this person into withdrawal, and anybody in withdrawal is desperate. And they will go to extreme lengths to stop feeling sick. And
how extreme?
I mean, I can tell you my own example. I mean, as in my own recovery, I mean, my own active addiction, I went to extreme lengths, took advantage of my privileges to write prescriptions. Physicians will do that. Nurses tend to divert from hospitals. Young men will steal from family and friends and possibly rob pharmacies. Young women will prostitute their bodies. People, you know, it's a common thread here that people in desperate situations will go to desperate measures because they feel sick. We have to remember that these are sick people.
And it's not just the people who are on the fringes. You know, we think of drug addiction as being something kind of on back alley, things that go on in back alleys. And
yeah.
These are professionals. This is across the whole spectrum.
Yeah, and I'm a face of the opioid crisis. I am somebody in long-term recovery. I suffered with major fentanyl use disorder. And you don't think of someone clean cut as being somebody in recovery or abusing, but I was. I mean, you should have seen me in these pictures. I mean, I looked horrible. But still, yes, addiction knows no boundary. It affects people from all walks of life. And I think being a physician probably hurt me because I was even less inclined to ask for help. You know, I got this under control. I've got this. I can take care of it. I can stop whenever I want to. And no, so I'm my own worst enemy. I'm probably the worst patient out there too. Very stubborn, and it took grave consequences for me to finally get help. I mean, being arrested saved my life. That's what it took for me to finally give up.
So when you look back on that first day that you took that first pill and your back was bothering you, do you regret that? Do you wish that there had been other options given to you?
So there's definitely room for opioids. I mean, as long as it's used carefully and as long as the patient's taking it properly. There's nothing wrong. In the beginning of that first prescription, I took it properly for the first year. But what I didn't do is a couple of years later, I tried it when I had some friends over and we were playing like Sony PlayStation Golf or something like that. And I was having a couple beers and I wanted to see what it felt like to have a couple Percocets. So that was the decision. You know, that I still wonder, like, why did I make that decision? You know, am I a bad person? Is it reckless? But I've learned in my recovery that this is adventure-seeking behavior that's shared very commonly amongst the population, especially young males. So that was the decision I go back to and say, you know, that was obviously not a smart one to make. I made a couple of bad decisions on the way. I've learned in recovery, though, to be careful when I make decisions. You know, think about the consequences. For some people, it's easy. Other times, you know, I can make impulsive decisions, but this is a part of who I am, and I'm not different than anybody else. A lot of people in recovery share the same thing: the impulsiveness, the adventure-seeking, risk-taking behavior. That's, you know, it's part of who we are as a species, really.
And to think,
so it's a matter of not making bad decisions,
right?
And I paid for it.
Well, and that moment really changed the course of your life for the last 5 years. So as we wrap up, when you heard earlier about the Johnson & Johnson decision, and you talk about the crisis and putting an end to it, did that give you some hope?
Yes.
Okay.
Yes, I mean, it's a drop in the bucket when you consider what's going to be needed to help start combating this crisis. We spent so much time and effort on naloxone or Narcan, the antidote, but that's treating overdose, but we're not treating addiction. And it takes time and effort and resources for people who are suffering with substance use disorder to take care of them and to learn. It took me a couple of years to get it. And so treating abuse in the first place, a lot of money needs to go in there. Prevention, to me, that's super important. It's getting into the high schools, teaching young people about making good decisions, about coping with stress effectively, not relying on crutches, not getting buried in alcohol later on and weekend binging, for example, that's so commonly exhibited by university students. It's about making decisions to take care of yourself. And that's what I found. The biggest thing I've discovered in all of this is that the opioid crisis, to me, is a symptom of a much bigger issue. It's a societal issue of poor coping with stress. It's anxiety, systemic anxiety. And I think it's super important to get in there when people are young, youth and young adults, to help educate them on how, coaching them, how to get through life because it's full of stress. And now we're getting more isolated now with social media, getting them a chance to learn how to speak and air out their problems. So, I mean, I was afraid of talking about my issues, and I've learned in recovery to share and not be afraid about being judged.
Well, I thank you very much for being with us today. I've kept you much longer than I'm sure you expected, but again, I think it's really important that we have this conversation, that we understand what this crisis is all about. Daryl Gebion, all the best in your recovery. Continued success to you.
Thank you.
We'll take a short break and we'll be back with more news right after this.